Hi, I'm Dr. Barakat from Barakat Orthodontics. Today I want to bring up a little issue called an open bite. So a lot of our patients have this, and a lot of people ask me again, what's the solution and at what age should that be treated? Now first, let's talk a little bit about an open bite. What is it? That's when the upper front teeth and lower front teeth don't come together. So if you take a look at these pictures, you can see that there's a space between the top and the bottom front teeth. At first sight, it doesn't look like it's a big deal, but if you think about it, when you're trying to eat a sandwich, bite into a pizza, anything that you have to bite with your front teeth, that's a problem for these patients. And a lot of times, parents don't know that there's a solution for it. They don't even notice that the kids try to compensate and eat in the back. And for an adult, they've always eaten this way. They didn't realize there was a better way. But these patients tend to avoid certain things that, for most people, are just commonplace, like eating a sandwich. Everything has to be a little bit of a special arrangement in order to make this bite work. So there are two ways where you can treat this. One is when you're early on and you catch it early, which is the best way. So always, this is why we like to see the patients when they're much younger. So if this kind of bite is there, we address it early and has a much better success rate down the road of staying stable. The other is, of course, it's never too late. So when you're an adult and you have an open bite, you still should seek treatment. It's never too late. It just requires a little different approach. I want to show you two examples over here. Right on this side is a child, and he has some baby teeth right on this side, and then the permanent teeth in the front. And as you can see, the tongue tends to show, and it's hard for this patient, even though they're biting down on the back, to be able to bite anything from the front teeth. And this is afterwards, and what we did was about 10 months of treatment where we used an expander and some limited braces to bring the teeth together. So the expander is there to widen the jaw and move it in the right direction, and the braces were to help bring things together. Now this job right here is not done. What we have to do is once all the permanent teeth come in, then we have to finish what we started. So we call this a phase one. It's the first phase of the total correction for the patient, right? And it's noteworthy that a lot of patients who have these open bites have certain habits like tongue thrusts or thumb sucking habits or finger sucking habits. So again, keep an eye out for that because that does contribute to this sort of bite. On the other side, we have an adult. See, all the permanent teeth are in. If you take a close look, the only teeth that are touching are in the very back. So as you can see, this patient has to really work hard to chew the teeth chew the food just on the back teeth that touch, and then has to work around all this open bite. In this case, we actually used Invisalign. And we used Invisalign for about 15 months or so. And we were able to close the bite like so. So if you take a look, this patient, when they smile, they have a nice smile. Teeth are straight, that's not the problem, but it doesn't function very well. And at the bottom, you get to see how, yes, the teeth are still straight, but they actually have a full bite and they can eat comfortably, sandwich, pizza, all the other things that are required.